Thank you so much. A'udhu billahi minash shaitani rajim. Bismillahir Rahmanir Rahim. First of all, I'd like to thank Liaquat University of Health Sciences for inviting me to give my views about AMR and. Okay, so these are the antimicrobials that we all come across and we use, and we have lots of physicians sitting here. I need to just take an excuse from them and give one of the quotations of Professor Dr. Tipu Sultan, a very eminent surgeon of Pakistan, who says that the worst abusers of antibiotics are, can you guess? You all know it. So he says that we are the worst abusers. Who are we? The physicians, the medical community, the medical professionals. And I'll tell you and I'll convince you with my talk, okay? So these are some of the, organisms against which we have antimicrobials available. But you all know that antifungals are very toxic, and some of the drugs for these bacterial infections are also very toxic, and for antivirals, they are really very, very toxic. Okay, so there are, you know that there are broad spectrum and narrow spectrum antibiotics. There is empirical therapy and there is specific therapy. So depending on what kind of antibiotic, what kind of infection is going on, you will use some of these. Okay, so it's very important to have a priority, refer to the priority list of antibiotics that should be used for a particular infection. Like I always say, don't use an atom bomb where a bullet will kill the man, okay? If a bullet kill the bacteria, you don't have to use an atom bomb. Save it for the time when you have very serious infection. So these are some of the lists you can see, but this is just, okay. So what is antimicrobial resistance? It is when the bacteria or fungi or any other... Oh, I see. Okay. Next, anyway. So antimicrobial resistance, whenever the bacteria or fungi refuses to take your antibiotic in, throws it up, spit it out, that is the time when the bacteria has developed a defense mechanism not to take the antibiotic. So that is antimicrobial resistance. But I don't want to go into the big science of the antimicrobial resistance. You know what kind of changes, but I'll show you some cartoons to help in that, okay? So this means previously effective antimicrobial drugs or antibiotics or antifungals used to treat the infections are no more good for you. So World Health Organization has identified AMR as one of the biggest threats to the public health. Okay, so this is what we have. This is the bacteria, and you have a fungal cell also, but this is a bacterial cell, and the antibiotics act on different areas. First of all, there is the cell wall, then there is protein synthesis, then there is RNA synthesis, then there is DNA synthesis. So there are antibiotics available for synthesis, cell wall synthesis inhibitors, we have protein synthesis inhibitors. And where do we have the antibiotic resistance genes? They are on the plasmids or maybe on the chromosome also. So all these antibiotics, when this bug refuses to take them in, we have a super bug. And the superbug is the one that we are dealing with these days, and that's why millions of people are dying of antibiotic-resistant strains causing infections. So why are antibiotics and antimicrobial resistance? Why do we always talk about AMR? AMR was never taken as seriously in Pakistan and some of the developing countries as this should have been given the attention. But now the global community is at risk because of AMR. So there are lots of countries which are now taking care. And the reasons given here, they are the ones who treat infections. Modern medicine, especially surgery, cancer, and other treatments, you need to use antibiotics. But if the antibiotics are not working, then it's a problem. So antimicrobial resistance, what's going to happen? It results in substantial financial cost for the patient as well as for the healthcare community and the economy of the country. So that's why AMR is important, okay? So now deaths due to antimicrobial resistance, if you have a look at this, there is a prediction that in 2050 there will be 10 million people who will be dying because of antimicrobial resistant infections. Okay, so antimicrobial resistance, how does this develop? I just gave you some information earlier. resistance is a very natural phenomena. Bacteria do develop resistance and it happens naturally also, but we are just trying to promote this activity. So the delivery of more complex healthcare, which may require longer use of antibiotics, if you keep on using antibiotics for a month or so because of some kind of surgery or something, then it can initiate the process of resistance and because of surgeries, etc. So resistant pathogens can now spread easily. Where do they spread? Mostly in the hospitalization. You go for treatment of one infection and you end up getting another infection, and that infection is more important than the infection for which you went to the hospital because it is with the drug resistant and potential for cross-border transmission through increased travel. So when I say that antibiotic resistance or infection in Karachi will be found in 2 days in Washington, D.C. So that's why they say that if they are not safe, we are not safe. If we are not safe, they have to be careful that they will not be safe. So it only takes one travel from Pakistan to any other country. Okay, so now this is the example where how antibiotic resistant, these are the drugs, they go to all these animals, they go to the human, and then overuse, etc. They come back. The nurses and the doctors and all other, so there is multiple use of antibiotics in the animal veterinary side also, and also in the vegetables. So this is the whole vicious cycle which gives you antibiotic resistance. And this is the bug, developing resistance. There are some genes which change, and then they also help in the transmission. So where do we use the antibiotics? All these communities, in humans community, as well as hospitals, animals, agriculture, crops, aquaculture. So if you use antibiotics so much in different places, of course it's going to cause problems. And it's not an old story. You see, Sir Alexander Fleming in 28 discovered this penicillin, but then in 50s we started having resistance to different antibiotics. And this is a global threat now. And I'll just take one example. I don't have the exact data from Pakistan, but a very civilized country like Australia, look at the amount of antibiotics being used for different purposes, as I just mentioned. And again, the problem that we have is in bringing a new antimicrobial molecule in the market takes about 7 to 8 years. And that's why there is a decline. We have not developed many antibiotics in the past 2 decades, okay? So we have to save the antibiotics which are available to us. So antimicrobial resistance global response, now people are monitoring it very seriously. And this antimicrobial resistance, which is mainly problem is antimicrobial resistance is also affecting the aged people who live in community and homes, etc. So high-level antibiotics are used with them. So that is also one of the cause of coming this. So now there is a global community which is joining hands. We cannot solve. This is a multi-sectoral problem that we have to join hands. So there are so many different organizations and societies which are working in monitoring the antimicrobial resistance in their own countries. And this is, we are celebrating antimicrobial resistance awareness, which is very important. Pakistan is also organizing it from 18 to 24 of November, and the whole world is doing it also. So now patient impact, of course, the problem with antibiotic resistance, like I said, the treatment fails and you need extended stay in the hospital, and that also create problems as well as financial and health positions, okay? So which infections should be given, antimicrobial resistance locally, what's happening in your health service, you have to get information through awareness. And then patient story, it's very important to listen to the patient. I was just talking to Anila Kazmi and she said, you're very right, we don't give time to our people, the patients are not important. They are the most important people. Arshi's problem, that I'm taking too much time. But anyway, proper diagnosis and proper listening to the patient, you have to decide what antibiotic should be given, whether antibiotics should be given or not. Okay, so these are some of the critical antimicrobial resistance agents. You can see all these organisms. They have become resistant to many important antibiotics. And we always think of giving penicillin derivatives, or cephalosporins, derivatives. But we have bugs which are resistant to so many, like 4th generation cephalosporins are becoming useless now. So this should be referred to, and these are some of the results from different studies that have been done. This is again inappropriate use of antibiotics, so we have to organize stewardship, meaning that telling people to make rational use of antibiotics and also not use antibiotics where they are not needed. Okay, so this is the stewardship plan that we have in Pakistan as well as in other countries. So we're joining hands with others also. This is to maintain a balance, importance of empirical therapy. Like I said in the beginning, you don't have to give a atom bomb right in the beginning. You can have empirical therapy and then decide after the results from the lab. So, then you can change the antibiotic, or you may not have to change the antibiotic. Okay? Essentials for, these hospitals, this is the awareness again, and also awareness, I'm going to go very quickly. Okay, this is what happens. Okay, so, okay, so the key message is, why does resistance occurs? We just talked about it, reducing it, the effectiveness of antimicrobial street infections. So these are some of the key messages. Now, AMR in Pakistan is one of the major health problems in Pakistan also, due to unnecessary large number registered products, the antibiotics, unjustified or misleading advertisements which are coming on TV and other channels also, self-medication, and also over-the-counter availability of the drugs. So more than 3 drugs per patient are prescribed, and 70% of the patients get antibiotics. Whenever you go to the hospital, you always get antibiotics, and it's not one antibiotic, at least 2 to 3 antibiotics. That is creating a big problem in Pakistan also. I'm going to go, I have running short of time. You note this, all these MDRs, typhoid, methicillin, MDRs, tuberculosis. This is still a problem in Pakistan. These are all MDRs, okay? So now this is important. Use of antibiotics in animal feed and animals, and in vegetables and crops also. That is also transmitting the bugs to the human beings, and these are resistant organisms which are causing infections in the human beings. Okay, AMR consumption data. Why we are having AMR problem in Pakistan? Unfortunately, we do not have enough consumption data about antibiotics in Pakistan. We do not monitor how the doctors are prescribing antibiotics. Are they sending the patient to the lab also or not, or they are giving antibiotic with the shooting in the dark? So that is creating a big problem. I think I'm running short of time, so you'll just look at these slides. Okay, so remember in COVID, I always say that COVID was a blessing in disguise. People learned how to protect their mouth from getting bugs from others. We learned how to get rid of bugs on our hands. So hand washing, that's very, very important. आजकल आशोबे चश्म है, उसके अंदर भी बहुत कुछ मसाइल हैं, लोगों की आंखों में बहुत मसले हो रहे हैं. So this is it. So to combat AMR, it is important to support one health approach, that is humans, animals, and plant, and of course the environment. That's very important. Okay, so wash your hands often with soap and water. Use alcohol-based sanitizer. If you're sick, make sure that you go to a doctor and you don't meet many people and you're not in the crowd. If antibiotics are needed, take the full course exactly as directed. Don't save the medicine for future illness. वो खराब हो जाएगी, expire हो जाएगी. Maintain a healthy lifestyle, which Dr. Shehzad ने अभी आपको बताया.